Hi friends, welcome back to Psychiatry Talks. Today I'll be talking about another major psychiatric illness, that is schizophrenia. Schizophrenia affects around 1% of general population. Now what are the symptoms of schizophrenia? First thing is something called hallucination. Now what is hallucination? I'll explain with an example. Imagine a person is sitting by himself in his house. Suddenly, he is hearing something like, "You are worthless, you are a waste piece, you should go and commit suicide. Someone is out there trying to kill you," and whatnot. So, this is hallucination for you. This is not actually happening, but the person hears it. Or a person may see something which is not actually there. Okay, so these kind of experiences may be very dreading for the person, and the person may feel very frightened, or the person may even act on it. Like for example, when he can hear a voice telling him that his neighbor is trying to kill him, so this person might actually go and complain it to the police, or this person may just try to kill the person himself so that he can be safe. Or a person, when he keeps hearing stuff like "you are waste" and you have committed a sin, to just end that experience, he might actually commit suicide. So it can be very harmful experience. Another symptom that is common in schizophrenia is something called delusion. Delusion is a firm belief in something which is or which may not be actually true. Like for example, there is something called delusion of persecution, where a person believes that someone is trying to harm him. Or there is delusion of reference, when the person believes that people are talking about him and people are referring to him. Okay. So these are delusions for you. The third symptom is something called disorganization. Now what is disorganization? Disorganization is something where your thoughts, your action, and what you feel doesn't actually match. Then there is this something called as affective blunting. Affective blunting is not able to express the emotions through the face. Like you cannot make out if the person is sad or angry or happy. You just can't make out. It's just the facial expression is just flat. Okay. Then there is something known as avolition. Avolition is just that the patient does not just feel like doing anything, does not have the initiation or the motivation to take up any task or complete it, and person has kind of lost interest. Okay. Next symptom is social withdrawal. A person may just withdraw himself from his friends, from his family, from his co-workers. Okay, this is social withdrawal. Then there is something known as Logia. Logia is something where a person does not talk, the person does not verbalize. That is logia for you. Then there is something coming to cognitive symptoms of schizophrenia. In schizophrenia, a person can be slow in thinking, a person may have memory issues, a person may keep forgetting things, or a person may just, a person may have difficulty in problem solving, planning, executing his actions, and whatnot. Then there is something known as catatonia. Catatonia is like a syndrome. Syndrome means it's a collection of symptoms. Okay, so what are the symptoms of catatonia? It is something like a person may just maintain some posture for really long time. It can be odd posture, like the hands or legs may be in a very odd position. The person doesn't talk much, the whole body kind of feels rigid, or the person does not eat food. Okay, then there are other symptoms. Or it could be totally opposite. The person may be very excited and run around, try to hit someone, etc. Then there are some general symptoms, that is because the person is so sick, like a person has all these issues. A person may lose his job because as I told, there are cognitive deficits. The person may not be actually able to do his work properly at his workplace, so he may get fired from his job. And when he's having so many symptoms, also a person is lacking any sort of motivation. Person may not be able to lead his family life properly. Divorce could happen. A person may be homeless, his family may outcast him, because the society may outcast him. So a person may just be homeless and not have any food to eat, no job to work, no family or house to live in. So a person may just die out in the streets also. In fact, you can see so many people roaming homeless around. One of them could be having schizophrenia. There are many causes for such wandering mentally ill people. One of them is schizophrenia. So we may have to look out. So these are quite common in schizophrenia. Now, what are the causes of schizophrenia? Okay, mainly basically there is some change in the structure or function of the brain. Okay, in my previous video while I was talking about causes of depression, I did mention how our brain works. Like there's wiring between the nerve cells. There are these transmitters which pass on the message from one nerve cell to other nerve cell. So whenever there's any problem in this functioning, schizophrenia can happen again. So what are the causes for this change in structure and function? So first thing is genetics. There are many genes responsible for many structural and functional elements in the brain. So when there's mutation, that is change in the sequence of any of these genes, it can lead to schizophrenia. Any pregnancy or birth related factors, for example, when there are any complications during the pregnancy or during the delivery per se. For example, if there's a long delivery process, the baby is not getting enough oxygen to the brain, or if there are any birth related injuries, all these things can be contributing factors. Even later in childhood or in maybe more of adolescent age, drug use, especially cannabis use, is known to precipitate schizophrenia in those who are already vulnerable for it. Other than this, there are some other factors, like for example, contributing factors like birth during winter, paternal age, when there is high paternal age. All these things are known to be contributing factors as causes of schizophrenia. Then there are few hormonal factors, like for example, sometimes schizophrenia is seen more commonly during in women when during menopausal age. So it has been suggested that even few hormonal factors may be contributing in schizophrenia. Now coming to treatment of schizophrenia. So what we can achieve with our treatment is to control the symptoms and make the person at least have a better life, to improve his or her quality of life, and also maybe to try to fit into community. So what are the treatment options available for schizophrenia? First one is medications. Coming to medications, there's a huge class of medications for schizophrenia, and this class is known as antipsychotics. There were older drugs, there are newer drugs. So older drugs had many side effects, like the person would be stiff all over the body, the person would be slow because of the medication, and some sort of dizziness and all that. But however, the newer drugs don't have. I am not saying the newer drugs don't have side effects. There are few side effects. However, there are different classes of drugs among the newer ones. So we can match the patient profile with the drug profile, and we can try to minimize the side effects. Then coming to brain modulation techniques, our electroconvulsive therapy, that is commonly called as shock treatment, it can be used in some cases. Then coming to RTMS, which I had told during my depression treatment slides, even that can be used for the hearing falls, as I told, all hallucinations, it can be used for that. Then coming to something known as family psychoeducation. It is very important to psychoeducate the family. The patient by himself or herself would not be able to take the medication. So the family's role in making the person take up the medication regularly, monitor the patient, get the patient for follow-up becomes very important. Then there is a concept called as expressed emotions in schizophrenia, where how the family reacts to the illness becomes very much important in the relapse of schizophrenia. Relapse means once we treat, the symptoms are controlled, again the symptoms resurface, and that is relapse. So one is family education regarding compliance, expressed emotions, and the nature of illness, which is very important, or the person may be kind of neglected, and the family may feel like the person is simply not doing any work, he's acting, he's not actually sick, there's nothing wrong with him and all that. So it becomes very important. There are also some other psychotherapy techniques, like for example, for long-standing delusions, there is CBT for delusions. Then coming to rehabilitation. Rehabilitation has a lot of role in schizophrenia. In rehabilitation, one thing is something called as cognitive rehabilitation, where we try to correct the deficits, the cognitive deficits, by making them do many exercises. Exercises means, something to increase their speed of thinking, to increase their memory and all that. Then there is other vocational rehabilitation, like, help the patient get a job because of the cognitive cognitive deficits, he may not be able to do the same job that he used to do before. So we try to train the patient to at least find a job which he can actually do and lead a life. Okay, these are rehabilitation techniques. A small note about yoga and schizophrenia. So now a lot of studies are being done, especially by NIMHANS, the premier institute, regarding yoga and how it can benefit in schizophrenia. So it has been found that, during yoga there are some changes in the hormones, and that can lead to some sort of improvement in schizophrenia when used with the medications. In this video, I have tried to cover basics about schizophrenia, that is symptoms, the causes, and the treatment options available for schizophrenia. I hope you all liked the video, and if you found this video is informative, please subscribe to my channel so that you can get many such videos in future. Also share the video among your friends so that it can pass on to many people. Thank you. Have a great day.